Hello everybody, good afternoon. Let's enjoy the chest radiographs with Dr. Y. I'm Dr. Y, chest radiologist, medical professor working in South Korea. Today's topic will be large cell lung cancer, session 16, large cell lung cancer. Let's review the session 15. We already know a lot about lung cancer, right? And we specifically already know about squamous cell carcinoma and adenocarcinoma. B. And now we feel more confident and more comfortable with lung cancer radiology. Let's go. First, I'll let you know some facts about the large cell lung cancer. Large cell lung cancer accounts for up to 10% or less than 10% of all lung cancers, not so many. Large cell lung cancer can occur anywhere in the lung, more often in the peripheral zone than the central zone. And majority of the patients are men, not women, and have strong association with smoking, very strong association with smoking. And large cell lung cancer tends to grow fast, tends to spread fast, so that can make us harder to treat the patients, and the results are usually not good. Large cell neuroendocrine carcinoma, a subtype of large cell lung cancer, is poorly differentiated and high-grade malignancy, so the results are usually worse. About the pathology. This undifferentiated tumor does not clearly look like adenocarcinoma, squamous cell carcinoma, and distinguished from small cell lung cancer by their larger cell size, larger size of the cell. And second, not only large in cell size, but also large in mass size on the radiograph. That's what Dr. Y says. Radiology about the large cell lung cancer. Usually, large cell lung cancer presents as a large peripheral solid mass with irregular margin, large peripheral mass. 2. Focal necrosis can be present. 3. Rapid growth and early metastasis is the characteristics of large cell lung cancer. Rapid growth and early metastasis. That's why the prognosis is so poor. So, large cell lung cancer makes us very, very sad. That's what Dr. Y says. In brief, in general, large cell carcinoma is the cell is large on microscope and the mass is large usually on the radiograph, and the prognosis is usually poor in the large cell lung cancer. Let's enjoy the pictures. This is the first case of large cell lung cancer. I think you remember this image. Yes, we met this image before. Yes, 1.5 centimeter solitary nodule in the left middle lung zone. We do not know whether this is in upper lobe or lower lobe because there is no silhouette sign applicable. Okay, solitary pulmonary nodule. For this patient, lung cancer is not good for him, and the cell type is large cell type. It's not good for him, but at least T staging, TNM staging is at least good for him because it is T1 staging, solitary pulmonary nodule, in peripheral type. Yes, we do remember this. Avoid solitary pulmonary nodule and left upper lobe in front of the major fissure, so it's in upper lobe. Large cell lung cancer manifested as solitary nodule. What do we see in this second case? Yes, we see something wrong here in the right lower lung zone, about 2 centimeters, or a little bit larger than previous case. Yes, SPN here. We do not know whether it's in middle lobe or lower lobe, but at least it's not in upper lobe. There is no silhouette sign applicable to this nodule. And we have something more at the basal lung. What do we see? Yes, lung fibrosis. This old man has lung fibrosis also. Solitary pulmonary nodule in the right lower lung zone. In this axial lung window setting, thin section CT, we see 2 centimeter round solitary pulmonary nodule. Yes, large cell lung cancer manifested as solitary pulmonary nodule, coin lesion. It's in right lower lobe because behind the major fissure, and the posterior basal lung shows some portions of honeycomb lung. So he has ILD, interstitial lung disease. Let's look at the third case of large cell lung cancer. Actually, this is large cell neuroendocrine carcinoma. This kind of features, this kind of findings is the usual manifestation of large cell lung cancer. Not simple as PN, but usually large mass in right upper lobe, with some kind of another mass in highlight area or middle lobe zone or lower lobe. Anyway, very large mass here. And we see the obliteration of right paratracheal stripe. This means there are many mediastinal lymph nodes here. 2R or 4R lymph nodes are here. And also we see the elevated right hemidiaphragm with unclear border. Maybe he has some kind of phrenic nerve invasion. It is strongly suspected. And he has also another pathology, cardiomegaly. This is the usual manifestation of lung cancer, especially large cell lung cancer. This coronal contrast-enhanced CT image shows everything about his condition. Large mass here, right mediastinal, right paratracheal lymph node enlargement, left lower paratracheal 4L lymph node enlargement, and right hemidiaphragm elevation, basal lung atelectasis. Yes, and this is right upper lobe, large cell neuroendocrine carcinoma with bilateral mediastinal lymph node enlargement with right side phrenic nerve invasion. Late stage with poor prognosis suspected. We have reviewed 3 cases of large cell lung cancer patients. 2 cases showed solitary pulmonary nodule and 1 case as a late-stage tumor. I would say in brief, large cell lung cancer is large in cell size and also in mass size on the radiograph. And second, large cell lung cancer grow fast and so aggressive. And 3, so the results are usually not so good, usually poor. Let's talk about the lung cancer policy in short time. First, good policy. I quit smoking. I myself quit smoking to escape from the fear of lung cancer. I quit smoking. What is better? It's social. No enter policy for the children to the smoking market. What shall we do? Yes, raise the cigarette price. Raise the cigarette price, then the children will not enter that devil's door. What is 3, the best policy? Yes, you would imagine, and I concur with you. That's it. Yes, we learned about large cell lung cancer. And let's go to the answer for the quiz. What is the name of the procedure? Yes, it's thoracolplasty. Thoracolplasty. What for? Tuberculosis. Treatment of the tuberculosis. When we were poor in medicine, no medicine for the tuberculosis patients, we have such operation for the patient as a treatment. Long ago, we used to do that. This is the quiz for the next session. How is her condition? Next session will be about the notorious small cell lung cancer. If we finish the next session about the small cell lung cancer, we will be quite confident about lung cancer on the radiographs and CAT scan. Good luck. Like, subscribe will be a big support to Chest Radiograph Dr. Y. Thank you very much.